Hello, everyone. Welcome to McGill Cares, a weekly webcast series addressing a wide variety of topics to support family and informal caregivers. I'm Claire Webster, a former caregiver who became a certified Alzheimer care consultant and founder of the McGill University Dementia Education Program. These webcasts are made possible thanks to the generosity of our donors and sponsors. Today's webcast is brought to you by Home Care Assistance. Home Care Assistance provides older adults with quality care that enables them to live happier, healthier lives at home. Their services are distinguished by the caliber of their caregivers, the responsiveness of their staff, and their expertise in cognitive care. I wanted to let everyone know that we will be having a special edition of McGill Cares on Monday, July 27th at 10 a.m. I have the great privilege of interviewing Margaret Blais, who is the minister responsible for seniors and informal caregivers. We will be having an intimate conversation about her personal experience as a caregiver and how this pandemic has affected her. So today we'll be discussing advocacy and end of life in dementia through a nursing lens. Both of our speakers bring professional and lived experience as they have both recently lost a loved one and have had to navigate end of life as caregivers. This year is an important one for nursing. Globally, the World Health Organization has declared 2020 to be the year of nurse and midwife in celebration of the 200th birthday of Florence Nightingale. For McGill University, 2020 marks the 100th anniversary of the founding of the Ingram School of Nursing. Talking about end of life, death, and dying can stretch many of us. Our speakers today will be bringing a nursing perspective on how to advocate and prepare as caregivers in the end of life phase. Louise Murray is the Director of Clinical Partnerships Office at the Ingram School of Nursing, McGill University. Prior to making the transition to McGill, she held a variety of advanced practice nursing roles at the McGill University Health Centre. She is the caregiver for her mother in long-term care who has dementia, and she recently lost her sister to cancer. Catherine Ann Miller is a faculty lecturer at the Ingram School of Nursing. She teaches clinical reasoning, ethics, community and global health at the undergraduate and graduate levels. She's also worked in advanced practice nursing roles, mainly in neuroscience, where she was especially involved in end-of-life care. Her father, who had Alzheimer's disease, recently died from COVID-19. Ladies, thank you for being on the show today.
Thank you.
Thank you.
So to begin, I would really like to acknowledge the fact that you have both recently lost your loved ones. Would you like to share a bit about their losses and how it's impacted you?
So first off, Claire, thank you very much for this invitation, and thank you for investing in providing support to caregivers. Interestingly enough, during this very challenging time where all of us are living a lot of losses, Louise and I had a very tangible loss. So 6 years ago, my father was diagnosed with Alzheimer's. And as you know, the trajectory has a lot of different small losses. And then around the holiday season, he was transferred to long-term care. And we were able to get him organized and know the staff and get to know. And then like every other person in Quebec, we lost the possibility to go see him in March, which was very hard, especially for my mother, who has been a courageous caregiver throughout this whole trajectory. Within that transition, at some point he was doing less well, and we had confirmed that he had gotten COVID-19. So he passed away at the end of April. And we've all had to adapt our rituals and adapt, how do we respond to death and dying in this very odd time? And within that trajectory, I was sort of the end of life advocate and the middle person for my family as he passed away.
I'm so sorry, and thank you for being on the show with us so soon after his loss. And I'm very grateful that you're here and willing to open up about what you went through. Louise, how about yourself?
I'd like to also thank you for the invitation to be here today. I recently lost my sister to a long battle with cancer. She was only 60, and we were lucky enough to be able to be with her the whole time despite the COVID. So I was with her from diagnosis all the way till the end. This at the same time as my mother was diagnosed with dementia 6 years ago. She happened to be in a rehab institution that was hit hard by COVID. And she was exposed, but by some miracle, she did not contract it, and she's actually fine as we speak. But I have been navigating with her, explaining, my sister's illness and her death, and helping her through, the grieving process. So it's been complicated.
I'm so sorry for your loss, and now you're still in the journey of caregiving. And so tell us, how has being a nurse guided you both in your roles as a caregiver? Has it made it any easier because of your knowledge? So how has your profession helped you in your roles?
I think I would say that caregiving came very early to me in my life. Becoming a nurse has provided me with the knowledge to be a better caregiver. In one of the sayings that we have in nursing is that they teach us savoir-faire, and savoir-être. And nurses, especially advanced practice nurses, use various frameworks or lenses to guide us with care. The Ingram School of Nursing, the strength-based approach is used, and this provides us with a lens which helps us to focus on strengths rather than deficits. So I would say that nursing has really helped me to use knowledge to understand strengths, aspirations, and hopes, problem-solving skills, communication skills, advocating for our loved ones. Many ways.
Mm-hmm. Catherine Ann?
So for myself, I started nursing with a first experience with the brain. So I love neuroscience, and it's been a key aspect of my career. So when I was working as a clinical nurse specialist, I had the privilege of walking alongside patients and their families with a life-limiting disease, but with lots of disability, lots of changes in terms of function and cognitive abilities. And that experience of seeing families struggling with those losses then was something I could use in my own personal walk with my father. So, for example, professionally, I often had a role of facilitating families and caregivers in reframing some of the behaviors that they were seeing. So not seeing it as who the person is, but seeing it as the illness. And it was interesting for me to do that learning early in my career, and then having to face it with my brilliant father, who was loving, but sometimes would exhibit difficult behaviors. And so that reframing was really important. And as Louise mentioned, in terms of the strengths, it was also seeing the strengths that were there and capitalizing on them. So for example, my father, even towards the end, still had a real love for music, a love for languages, and also found comfort in his faith. So how could we use that, even though he had lost so much? The other thing for nursing is the idea of knowledge and the clinical reasoning. So understanding the system and understanding how to navigate within the system so that it's easier to figure out and make decisions, for example, in end of life.
Mm-hmm. I love the word reframing, and because I think one of the biggest challenges for family members caring for a loved one with dementia, especially at the beginning, is really realizing that they have to let go of who the person was and really start to evolve with who the person is becoming. And that's, I think, the biggest challenge at the beginning is really letting go. And then, because the person cannot change, like you just mentioned, it's the disease, it's not the person, but it's the caregiver who needs to change. And that I find is one of, it's very challenging. So fortunately you had those tools to be able to be able to walk with him. I love that word, also using the word walk with him, accompany him on his journey. So we're talking about end of life. I wondered if you can both define this in the context of dementia care, because, I was completely not prepared at all for, I wasn't prepared at all for the end of life.
Mm-hmm. So professionally, my background in neuro-oncology was, there was sort of this trajectory that you could sort of point to. And often we would have direct signs of this, we're transitioning to more of an end of life phase. In dementia, it's less straightforward and sometimes a bit nebulous. And I'll explain a bit why I say that. First of all, people who have dementia often have other illnesses that are already present. So we know that people with age have more and more chronic diseases, sometimes up to 7 different chronic diseases, or cancer, or heart disease, or diabetes. And therefore that can also limit their lifespan in addition to dementia. So as nurses, we have all cared for people who have an underlying dementia, but also have cancer, have, chronic kidney failure, things like that would limit their life. And then there's also the end stage Alzheimer or dementia that can last years. And the complications of that often are because of the cognitive and functional deficits that are there. So when a patient starts to fall more, starts to be more immobile, if they are more incontinent, if they start having difficulty swallowing. So all of these deteriorations bring about complications that can then lead to their death. And so also there's less of an ability to combat infections, and all of those deteriorations leads to more complications and infections. So caregivers need to know that when the patient or loved one starts having those symptoms, they become more and more frail. So often it's sort of this zigzag of infections here and there, and they lose a bit of ability. Maybe they're transferred to hospital, but then when they come back, they've lost a bit more function, and they're more at risk of those different complications. So that's where we think about more end of life, because these will continue to deteriorate. Mm-hmm. So when those signs come about, I think it's really important that caregivers ask questions to better understand and advocate for their loved ones in end of life.
Mm-hmm. I didn't realize that end of life could actually begin 2 years prior to the end of life. Like when you're describing those symptoms, my mom started exhibiting those symptoms 2.5 years prior to her passing away. And, I wasn't, because I wasn't educated on what it looks like. I felt like when she started to fall, okay, I would respond by saying, okay, now the decision to get her from a walker into a wheelchair, or, I didn't recognize these as the end of life. So what would you recommend? How could people prepare themselves? Like what could they do to best prepare themselves for the end of life? I mean, is it paying attention to the changes, or, how could people really prepare themselves?
So I'll reframe that a bit, but look at how do we prepare in general in terms of those changes, and how do we prepare for potential loss through time? And there's different phases when we think about dementia, because there's the diagnosis, but then there's there's a lot of those losses. And when we start seeing more of these patterns, it's really important that preparation was done beforehand. So if I think about advanced practice, advanced care planning. So I think that is one aspect that is really, really important, that caregivers are cued by their healthcare providers to start talking about what are the signs that point towards end of life, and also how to prepare and have that anticipatory guidance.
Okay, so you both mentioned the importance of advocacy. How do you feel this plays out, and how would you encourage caregivers to know how to advocate?
I would start by saying the most important thing that I I mean, there's many, but I mean, knowledge is power. I think that's really critical. Asking questions, reading, getting to know your healthcare team, understanding, you know, Catherine Ann talked about, you know, the trajectory of what this illness looks like over time. It's not going to look the same for everybody. And the signs are not always clear. Like, you know, a urine infection might be just a urine infection, but it might, you know, it might be a trajectory. I think that understanding what the team is supposed to be, the type of care that they're supposed to be providing for your family is the first, you know, is the first step. And are they doing what they're supposed to be doing? And if they're not, how can you work with them to make changes? Who's accountable? You know, if you're seeing, you know, inadequate care, how can you advocate for your loved one? And the first one is really just to be present, to understand their needs, to see what the teams are doing, what they're not doing, what are the constraints, what opportunities are there for making changes. You know, engaging in support groups, all of those things are really ways of really developing our own knowledge, and therefore being, you know, much more able and have more tools to really advocate for what our loved ones' needs are.
Mm-hmm. Catherine Ann?
And I would say as nurses, we come with a certain lens with regards to advocacy. So advocacy is really central to our role. It's central, it's sort of one of our moral imperatives, given that in our code of ethics, we're called to focus on alleviating suffering and promoting dignity in our patients and families. And in collaboration with caregivers and families, I think it's really important that caregivers understand their really expertise and centrality with regards to their loved one. So caregivers, especially in situation of dementia care, are holders of who this person is. Mm-hmm. And sometimes as caregivers, as nurses and healthcare providers, we don't see that because of all the losses. But the caregiver knows who this person is, and therefore is their voice, and needs to advocate and step up and say, this is who he was, and this is how he would want to be cared for. Because as healthcare providers, we're wanting to give the best care that we can. And so it's really important that caregivers feel empowered to speak so that they can align decisions according to who the person is.
I would say I spent probably 50% of my time advocating on behalf of my mother. And what I always feel that as caregivers, the three biggest objectives are happy, safe, and clean. And, you know, it is a privilege to take care of another human life, you know, and with my mother, when she got to the point where she wasn't able to communicate properly and represent herself, for me, no matter where she was, whether she was in a hospital, she was in a whether private residence or long-term care facility, that was my objective: happy, safe, and clean. And if one of those areas wasn't the way that I expected it to, then I was advocating to ensure that it was done properly. And, you know, unfortunately, and I think what caregivers need to realize is that it's a constant journey of doing that. You know, there are some, and because you have to work with healthcare professionals, you have to, you know, and, you know, people are, well, especially in times like today, people are feeling very, very overworked and people are tired. But, you know, when I talk to students today, you know, they have to come into it with a sense of compassion for what the family members are going through. And it's important also for the caregivers that when they're communicating with the healthcare professionals, that you have respect towards the healthcare professionals, you know, that you really communicate properly what your expectations are. But Louise, what you said at the beginning in terms of education, in order to be great advocates, you must be as educated as possible. So if you're thinking of transitioning your loved one from a home into a long-term care facility or to a private residence, you really need to be educated on, do they have the right services? Are they going to be able to take the proper care? Because you can't expect to transfer somebody to a place where they may not have the right services, right? So you really, education is really key on this. But just know that, especially with dementia as compared to other diseases, as the disease progresses and the person can no longer represent themselves, your primary role does become advocate. No, I just needed to add that because it was just such a big role that all of a sudden I didn't realize that I had assumed this as, I'm an advocate, but it was very important. So we talked a little bit, but maybe we could expand a bit more. So what are the main decisions that families need to do and take in getting ready for end of life care?
So I think, Claire, you put sort of a good lens in terms of the idea of advocacy and how you lived it personally. The complexities with end of life and dementia care is, as you put it, the voicelessness. So you become the voice of your loved one. So I come back to advanced care planning. And I think in advanced care planning, we're trying to figure out the who, the what, the where, and the why. And there's a variety of components within that. So first of all, what I would encourage caregivers to think about is that advanced care planning, although it's hard to talk about these things, there's benefits. So the benefits is that decisions are more in line with the person who has dementia. It's like honoring their wishes. Also, the quality of life is improved, and there may be less invasive procedures or unnecessary transfers. Also, for the family, and caregiving is really, really hard. And so talking about these things in preparation decreases conflict within families and also decreases distress at those very difficult moments where hard decisions have to be made. So in terms of the who, what, where, and why, so first of all, who will be making these decisions? So have we identified a substitute decision maker? I think that's really important, and even earlier in the trajectory to figure out who is the person who will make these decisions if ever the person can no longer make them. The what, we're thinking about different treatments. We can think about medications, CPR, transfer to ICU. We can think about hydration, feeding, also pain management, which is a huge issue in end of life. So there's a lot of decisions that are there. And I'll come back to some of the questions that caregivers need to ask. There's also the where. So you mentioned those decisions of transferring and the knowledge of what services are available and what does my loved one need, and having it aligned. Making those decisions can be very hard. There's also the decision of being in long-term care, whether or not they're transferred to the hospital. So the where is important that we think about, because as we know, somebody with dementia, every single transfer can be quite difficult because they lose their environment and their cues of the people that they recognize and the environment. And then there's the why. So the why is at a micro level is sort of like why, what are the indications? What are the risks and benefits? What is the goal of this treatment or the decision? But then if we look broader, there's the bigger why. What is our long-term goal? What is the aim that we're going for? And I do want to point to a book that I found very insightful professionally, but also personally. It's Dr. Atul Gawande wrote Being Mortal. And he takes the premise that we are in a death-denying society and that we don't talk about death enough. And he is a physician, and he also relates some personal experiences. And he identifies some questions that are really important to get the broader why. And I've used it professionally, but I've also used it in my own thought process with regards to my dad. So the first one is understanding the illness. What do you understand of this situation? The second one is, what are your fears and your worries for the future? And then what are your goals or the priorities? Then the fourth one is, what are the trade-offs? What outcomes are absolutely unacceptable for you? And if we're able to have those questions earlier on in the dementia trajectory, it might help those decisions at the end. And then lastly is, what is a good day? What does it look like? What are your hopes? And I found that helpful, but I don't want to minimize that having these conversations is very difficult. And if you are in a situation where your loved one doesn't want to talk about his diagnosis or so on, it can make it very difficult. But coming together as a family and having the bigger goals can really help. And I think for myself personally and my family, we were all on the same page because we knew who my dad was, and we knew what our big goals were. The decisions were hard sometimes, but the big goal, we were on the same page.
You know, it's so amazing, and I'm just in awe of everything that you said. And I wish I had this webcast for when I was going through it, because I wasn't prepared at all. I mean, I had seen my mother's condition deteriorate over time, and I'll never forget, I was at a conference in Ottawa on dementia, and I got the call that suddenly she wasn't able to swallow. And I rushed back to Montreal, and you know, within the 36 hours, she had passed away, and I had witnessed this, but I was not prepared at all. I wasn't prepared to make all these decisions. And I mean, I was completely caught off guard, because I mean, even though I had seen her condition becoming more frail, I had not been prepared at all. And, you know, that overwhelming sense of responsibility, those thoughts of, you know, how much morphine to give, or was it time? It's incredible. And, you know, I always say to people now that I work with, you know, you always want to be one step ahead. Like, no matter where you are on the journey, please be one step ahead. And I think one of the most important steps ahead is to be knowing what the wishes are, because even with regards to her funeral, I had never had that discussion with her. I didn't know. So at the end, you know, you're just finished witnessing the end of life, and then you have to make all of these decisions on behalf of the person. It's very traumatic experience to go through. Yeah. Louise, is there something that you'd like to share on this topic as well?
I just want to add the importance of, you know, all the steps that you've just described, and Claire, your experience also illustrates what I was trying to bring before, is really understanding, you know, your loved one, where they are at, and how things might go, so that you can have those discussions with a healthcare team. And that sounds simple, because, you know, everybody's busy, doctors and nurses, the teams change and whatnot, but everybody somewhere has a nurse, they have a social worker, there's a liaison nurse, there are all kinds of professionals, physicians around us who, you know, when we ask and when we really say, look, you know, we want to work with you, there are ways that we can, you know, that we can get assistance to do these things, because they are extremely hard. There's no question, but they're incredibly important, as we've just discussed.
Yeah, and so I think that those are really the messages that you have communicated regarding being prepared is priceless. Really, thank you for that. So, what would be the most important pieces of advice to family and informal caregivers right now in terms of looking after themselves? Because all of this takes up so much energy. So what would be, based on, okay, what I mean, as professionals giving the advice, but also having gone through this personally, what would you advise to family members?
A few things. I would say that this is very much a journey, and that it's one that we're accompanied by, you know, numerous people. I learned a lot about end of life from my father. My father passed away 8 years ago, and he was incredibly wise. And I realized through my discussions with him and my mother at the time, my aunts and uncles who were of the same generation, many elderly are pragmatic about death. They have more experience than we do, and they know themselves, they know what they want. Now, I'm not generalizing for everybody, but my own experience has taught me that they are also a source in addition to the other caregivers and healthcare members that we've talked about. As Catherine Ann illustrated, this may or may not be a short process. It's variable. So understanding, you know, what they want, what they wish is incredibly important, especially when we have to speak for them, because they cannot speak for themselves. So understanding their own values and beliefs, and their hopes and aspirations, their strengths, and how are those different from our own. That was very important for me, because for a while, my sister and I, we would talk about what we thought was, you know, should happen. And then I would come back to the question, but is that what mom and dad really meant? Or is that what they think or what they would want? And over time, I realized, and my sister and I, my sister before she died, And I had this discussion where we realized that we had been in this mode of really protecting my mother a lot, and that we were sometimes listening but not hearing what she was saying, because we were always in this mode of feeling that, you know, we really had to be her protectors. And we realized in that moment that, you know, yes, that was an important role, and advocating for her was critically important, but we had to spend a little bit more time listening and not underestimating, you know, some of her strengths and what she was still able to do, and make space for her when she really wanted something that she could have, even if it didn't seem maybe that important to us. We're like, yeah, but it was important to her for reasons that we don't always need to understand.
Mm-hmm.
So I think reflecting with others has really helped. So, you know, what is reasonable? What, you know, what's going to happen if this choice is made or that choice? Will there be a lot of suffering involved? If so, how will that suffering be alleviated? Can it be? You know, how will it be managed? And I think the most critical thing that I would really want to talk about is also understanding, like parenting, caregiving is laden with emotion.
Mm-hmm.
If it was not important to us, or if it was minimal, we wouldn't, you know, it would be simple. But it's not, because we love our, you know, our parents or the persons that we're caring for. We're torn by, you know, their losses, our own losses, our fears, you know, what's coming, what's not coming, what we can't control, so many things. So knowing when we need to seek help ourselves to, you know, release some of that and talk some of those things through is critically important, because nobody can do this alone. And in the end, we can't give what we can't what we don't have. Mm-hmm. So taking care of ourselves is incredibly important, so that we can continue to take good care of, you know, of those we've said that, you know, we'll support. So those are some of the insights that I wanted to share this morning.
Catherine Ann, would you like to add some?
So in terms of advice, I would again come back to talking about these difficult decisions. And I know I might be harping on it, but I think it is really essential. The other thing I think Louise mentioned is that community of support. Who surrounds you? Who can you wrestle with different decisions? Who can you talk to with regards to all the emotions that it brings up? The other thing is the education piece. So as you mentioned, Claire, knowing, and Louise also mentioned it, knowledge is power. And so knowing things, participating in workshops, listening to people who have walked this difficult road before you. For myself, I know colleagues, for example, I have a few colleagues who've lived this, for example, Louise, and just having that check-in. How's your dad going? Mm-hmm. What's new? And sometimes just a hug was really important. Also having friends that I could wrestle with in that last week, which was more difficult. The other thing I would really bring up, and I think Louise mentioned, you know, you can't care for someone else if you're not caring for yourself. And one of the things professionally that I would often do when I would start a therapeutic relationship with a patient and family is to know what brought joy to the patient, but also what brought joy to the main caregiver. And for me, it was a tool, sort of a barometer to understand where they were at. So I would often review within the illness trajectory, had they gone out on their porch and watched the birds? Had they painted? Or had they played with their grandkids? Or had they watched a game of Les Canadiens? Mm-hmm. And because it was a barometer as to, are they taking care of what brings them meaning and joy? And I would say for us as caregivers, and that question is really important too. So caregivers, often there's a selfless act and there's no time to think and ask. And so I would encourage caregivers who may be watching to ask themselves what brought them joy, what still brings them joy, and what are the steps that they could put in place to rekindle that joy? Because maybe they haven't had the chance to reach out or go for a walk in the park. But what could they put in place so that could come back? And in terms of my family, my parents loved nature and loved walking in the park. And with my father's death, it wasn't possible to do a regular the rituals that we would want. But what we did is we socially distanced and gathered in the park that he loved. And within that, we were also witnessing one of the joys that he had and living it in remembrance of him.
I ask that question with families all the time, what brings you joy, and why do you feel you don't have permission to also have a life? Why is it? I was in the same place. Well, I didn't feel that. And I kept saying, well, I don't have any time. I don't have time. Or, oftentimes when a caregiver does have somebody that comes into the home to provide respite, instead of taking the time to go out and do something for themselves, they stay and watch the professional caregiver care for their loved one, right? But it's almost as if we're not allowing ourselves any joy, whereas that's the most important tool that we need. We need some joy in order to be able to do our jobs even better, right? To refuel ourselves, to re-energize ourselves. And it's just a common, it's like we go to that, no, I can't, no, I'm all good. I'm not ready. I'm all good. But why, right? I mean, we have permission to have a life as well. So that's very, very good advice. So I have a question now, because at the beginning of the webcast, I asked you how your professional experience helped you deal with the journey of caregiving. How has your professional experience helped you deal with now the grief process? Because that's not something that we are also educated and supported about, right? So how are you both doing on the journey of grief?
I think that what I know about grieving is that it's not easy. It's very, very hard work. It takes a long time. And because it's laden with so much emotion, it's very difficult to predict, to understand. And this is an instance where we have to be incredibly kind to ourselves and understand that we don't control any of it, and that we have to leave ourselves space and time, and we have to be kind to ourselves and allow others to support us through that time. I think that is something that I tell myself, and that I would tell anybody who I love or who I'm trying to guide. I think that grief has whether we're grieving the loss of a loved one or the loss of our loved one's functions. I think that we have to recognize grieving. It's not so obvious sometimes. We talked about a few minutes ago, you were talking about finding joy. And I would say that in the case of my relationship with my mother and my trajectory, I think that being able to let go of who she was and accepting who she is now has permitted, and that grieving of that has permitted me to really find joy. So the two are very much interrelated, in my opinion. Now that I've let go of the guilt and the frustration and seeing all the deficits and the scared and everything else that came with that, I've been able to come back into another space where I can be with her, recognizing that she will have more progression sometime, but now that she's in a good space, I want to enjoy that while I can. I've rediscovered her somehow. Mm-hmm. So the grieving occurs on many different levels and at many different times. And I think that being supported by, those who can help us, those who know us, those who love us, is very, very important. And giving ourselves permission is hard.
It is. Catherine Ann?
With regards to grieving, in my professional role in my previous job, one of my roles was to do bereavement follow-ups with caregivers. And so I would reach out and call them and listen to what they were living. What that taught me is that grieving is not a one-size-fits-all. And people grieve in a variety of different ways, and it's all good. And, there is, we talk a lot about the cycle of grieving, but it's more of a mishmash of all of these odd emotions that come. So what I've taken from my professional world to my current grief is, like Louise said, a bit of kindness, of accepting that it's not really a trajectory. It's not going to be over. Also, it's learning, we're both grieving in a very odd time. And you've had speakers talk about this in terms of grief. And the rituals, trying to find and be creative with rituals, and acknowledging some of your needs to speak about, your loved one and remember them as they were a long time ago when they were well. And so my grief, I think, is very odd. It's not how I would have foreseen it. I would have foreseen being beside my dad when he passed away, which wasn't feasible. So I'm grieving also the end of life that wasn't supposed to be this way because of COVID. But I think I can look at what I've learned professionally and use some of the patients and families that I've seen and take some of their strengths and try to apply it to me.
I have to say thank you so much to the two of you for sharing your personal journeys, your professional journeys with us today. I mean, I think that it's incredibly special, the words of advice that you have shared with everybody, permission to have a life, permission to be kind. And I think education is key. That's what we, our intention with the McGill Dementia Education Program, for which McGill Cares is part of, the education is key. I cannot say that enough for caregivers. Support, find the local resources we have listed. McGill Dementia, a whole list of resources in the community that can help you. Education and support, and being one step ahead at all times. Ladies, thank you so much for joining us today and sharing your personal stories. Next week, we will have 2 episodes of McGill Cares. We will have a special edition on Monday, July 27th at 10 a.m. I will be having an intimate conversation with Margaret Blais, the minister responsible for seniors and informal caregivers. That's at 10 a.m. She'll be sharing her personal journey as a caregiver and how the pandemic has had an impact on her. And then on Wednesday, July 29th, at noon, the topic will be Much Too Young, the Impact of Early Onset Dementia, with Chris Wynn, who is a former caregiver and filmmaker, an Alzheimer advocate, and a great friend of mine. This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. Once again, I would like to thank our sponsor, Home Care Assistance, for making this webcast possible. If you'd like to make a contribution or for more information at our program, please visit mcgill.ca/dementia. And if you have any questions regarding what you've seen today, or you would like to make suggestions for future webcasts, please email us at dementia@mcgill.ca. So until next week, please take care of yourselves and of your loved ones. Thank you for joining in.
Thank you.
Thank you.